Okay, so I would like to talk to you about fluoride. Now, this is a very interesting topic nowadays. So you have people who love getting fluoride for their teeth, and your dentists most likely would have actually learned to provide fluoride for their patients because it is what we consider as a very, very good remineralizing agent. Okay, let me explain to you what a remineralizing agent is. It's a material that is very similar in crystal structure to a natural tooth. So basically, it's like the building blocks of your tooth. Yeah? So fluoride is a different kind of building block. You have your enamel structure, and every day how decay actually happens is that you lose some building blocks in your tooth. And what we realized more recently is that these building blocks can actually return to your tooth. And fluoride is one of those minerals that can actually return into your tooth structure. Okay? Now, fluoride has been discovered a long time ago by accident that when someone actually is exposed to fluoride, their teeth actually ends up being harder and stronger than it naturally was. So that's why the dentists started to recommend that fluoride was used to the point of having it in the water as well. Now, in recent years, there's been a lot of debate about the safety of fluoride. And it's a very nuanced argument because you have one faction that says fluoride is so toxic and actually, destroys your kidneys, it actually affects your health in general, and it lowers the general IQ of children. Now, there's again a nuance because what they found is that if you have a lot of fluoride, then that can be an issue. So one thing to actually consider is how much fluoride should you have. And in Singapore, just to give you an idea, is that we have 0.6 parts per million of fluoride in the water, which is a very safe dose. Usually up to about 1 part per million is completely safe. In Australia, there's also fluoride in the water. If you really don't want fluoride, that's also quite okay. And I also get a lot of patients that talk about fluoride and how they don't want that fluoride. And so it's a personal choice. But then my question to the patients would be that you also have to avoid a lot of sugar, because sugar is what makes you lose all those building blocks in your teeth. Okay, so acid damages your teeth, sugar damages your teeth, and so if you are not going to have the remineralizing blocks that go back into your teeth, you don't want to lose them so much anyway. Okay, now there's also other choices apart from fluoride, but before I go into that, more so about fluoride and how that's actually very important. Now, I agree that fluoride in water may be not as effective as other ways of getting fluoride. So the most important thing when you're using a fluoride toothpaste, let's say every day, that's really safe to do, but you want just like a green pea size amount on your toothbrush and have your toothbrush dry. And then you brush your teeth, and you only need to do it twice a day. Spit out the toothpaste, and it's completely safe to leave it on. Now, if you have a child that's under the age of 3, our suggestion is not to use fluoride at all. But once they reach the age of 3, they can actually have adult amount of fluoride as long as they actually just use a green pea size amount. Okay, so that will give you maximum effect with minimum amount of fluoride. So I had this one story to tell you, is that about 6-7 years ago, I had a patient that came in and was very adamant of not having any fluoride. And I spoke to him ardently about needing to improve his mineral structure on his teeth. And he said he would do anything but he wouldn't have fluoride. And he asked me, actually he demanded that I try to update myself about what's going on and how unsafe fluoride could be. So I promised him that I would go away and research all the things that I've studied when I was in university, and basically looked up 200 articles, read through all about fluoride, and started to learn that actually there are some researchers that have reversed their stance on fluoride. They thought it was really good before, and now they don't think that it's good, more so in the water. But fluoride toothpaste is still relatively safe. But if you don't want that, then you can actually use different types of toothpaste that don't have fluoride, but you need to look at the mineralizing agent. So watch my next video because I'll be talking more about mineralizing agents in the future.